Doc Shingles is here. He's the man. Let's discuss knee issues. All right, so here's how the setup is, everybody, because we have absolutely prepped zero. Mike's been on the show before. Mike, we're going to talk some more about the arthritis thing. I find the arthritis thing very, very informative because I have it. So it's like I'm selfish. And one of the early times you were on the show years and years ago, you did the theater of the mind of the tire and the tread, and you don't put the tread back on the tire. Now today you expanded that. I hadn't heard that before, but let's kind of open that. Let's go back down that road again, paint that for the listeners that just joined us, and then let's carry it through, because this is a really important topic. Because like you said, if you can deal with it, I knew you'd be happy to hear that, it's better, because that's what you docs want. You want us to be pain-free as much as possible. So please go right ahead. The analogies of the tires. So, from the tread to the Yugo to the tank. Go ahead. It's not you, man.
The dump truck. So no, I mean, you're only given one set of cartilage in your joints, and given one set of meniscus for your knees, which is the shock pads basically of your knees, and then the cartilage is the treads of the tire. And when that wears down, then you start getting instead of squeaking and grinding, you get pain and stiffness. And so
I call it cranky, Mike.
It's cranky, and we're all going to get it. No one's immune to it. Meniscus, we do so much meniscal surgeries on people in their 40s and 50s because that's what they get. They start that meniscus, the warranty goes out of that shock pad and it tears, and they're not doing it pickleball. They're walking their dog and they tear their meniscus. And we can clean that up, but it doesn't change the fact you lose that shock pad, and then you're less active in the second 50 years of your life than the first 50 years. But still, people are becoming more and more active, and they're wanting to extend that longer and longer. And everybody wants to know how. And so there's a lot of money going into biologics right now. What can we inject into your knee to make your cartilage grow back? I mean, that's been ever since I came to Orthopedic. That's the whole search for Holy Grail, is how we can replace cartilage. We can sequence all the DNA, we can grow it in a lab, but we haven't figured out how to put it back yet. And so you got to be careful with all these opportunities to have biologics injected in these stem cells, PRP. There's lots of different things. And there's a lot of money being made from that because it's hope for patients. And I always tell people, when you're looking at treating your knee, is like, how much are you paying for it? How much relief are you paying for it? If you're paying, and I tell people ice is the best thing because ice is very inexpensive, and most people get a lot of relief from it because it's anti-inflammatory, decreases inflammation to the joint, makes your knee feel better. And so you're paying that much for it, and it's good relief. Biologics are up here. You can pay $5,000 for a shot, $10,000 for a shot. You better make sure you're getting the results for that, because if you're not, you're basically wasting your money. And that's the problem, is we don't, it does help some people. We used it with their athletes at Michigan State because it was affordable for the university to provide that for their athletes in some situations. But most of us can't just go out and spend a ton of money on a shot. Chondroitin sulfate glucosamine, turmeric. There's when people tell you this is a cure for arthritis, it makes me feel so much better. Everybody's different. Like you made the example of, like, for you, it wasn't working from your hips down, it was working from your ankles up. You found that out because you work on it. You're trying to find ways to feel better, and you found that out. For a lot of people, it may be working from their hips down. Chondroitin sulfate glucosamine is a perfect example. You give your dog that chondroitin sulfate glucosamine in their water when they get arthritis, and they're the happiest things in the world. They don't know any difference. So it works in mammals, it works in humans. For a lot of us, it decreases inflammation. But one person will take it, it doesn't do jack, and another person will do it, and it's the best thing ever. And so you just got to find the different things that are out there and be cost efficient on it and do it and see if it works for you. And if it doesn't, then all right, it didn't work. Magnets, knee sleeves, acupuncture, you can name it. We don't have a cure. None of these are cures. All they are is treating the symptoms, but there's a lot of things out there that you can try. CBD oil being a newer thing in the last few years. The problem is with CBD oil, it helps a lot of people, but other people it doesn't help. So don't just keep taking it just because someone told you it's good for you. Take it because you get a relief out of it.
Right, exactly. I mean, that's the whole thing. And I knew you'd be happy to hear that. It's just continue and as you say, everybody's different. And it's like the tire getting wore off the tread. I got to ask you a question. You know, we got about 4 minutes before we go to break. One thing I've noticed for me, and I talked to a guy once when we were on our latest road trip out west this past January, February, sitting. And sitting, it seems like causes the tightness. And what I've discovered is if I do a couple little stretches before I get up and walk, you know, we make that road trip. You make that road trip to Au Gres, which I know very well. And we make the road trip to Wisconsin, which is 6-7 hours in the car. And I'll tell you what, man, doing all this computer work and all this editing and all of that, and then the driving and that, the sitting is a kiss of death. Why is that?
It's called theater sign, named after this pastime in the United States of going to the movie theater and sitting during a movie, because nobody does that anymore. It's unfortunate that's lost from COVID. But sitting in a theater, I call it Breslin sign, sitting in those tight seats at Breslin with your knees flexed, driving in a car. Usually it causes anterior knee pain. And when you get from the sitting to the standing position, 30% of your body weight, again, body weight, keeping your weight down, 30% of your body weight go across the patellofemoral joint, the kneecap joint. So tracking of your kneecap, if there's arthritis there, you're going to notice it more when you go up and down the stairs, when you squat, and when you sit for long periods of time and get out of a chair. And that stiffness, which is extremely common, and then even painful for some people, is really it's a mechanical thing, you know. And so you do the core strength in the quads. That's one thing that physical therapy and strengthening and core strength is really, really important for. When you have that problem, you can tremendously help it.
That's the whole thing that I found now. And I was going to mention to Mike that I found a deep groin exercise, which I do have a video up, everybody. And I'm cutting this stuff and using myself as my own guinea pig. So you can see what I'm doing, if it's working or if it's not working. So you could just take it for whatever it's worth. If it's helping, and I'll tell you if it's helping or not, but the deep opening of the groin. And I was amazed, Mike, that it was really quick. And then the other thing that I found, and I'm going to carry this through, we can come back in the fifth segment and talk a little more about this, was the heel wedges. They call them foot docks, but they're heel wedges for the squatting. And that has changed that angle. Dude, those things have been so I did another review for this thing, you guys. I carry them to the gym now, kind of a pain in the butt because they're kind of heavy, but the rubber blocks that are angled, and there's 4 different angles you could have. So it's very, very effective. So I'm going to reset this thing. Doc Shingles is here. Mike Shingles, my doctor, my friend, known him for 25 years at the university. Great guy. Let's discuss knee issues. We come back. I'm going to throw the question of the 5th segment to my friend. And if you missed the 5th segment on the broadcast side, please go to the podcast and pick it up, because these are really popular. Or you can just go to YouTube and you can go to the RFZ channel and you can get the video clip of his messages. I always cut that segment out for you to have. So be aware of that. Doc Mike Shingles here. I'm Tom Matt. Let's discuss knee issues. Coming back out of break, we're going to talk about messages to my younger self with my bud, Mike Shingles.